blood circulates throughout the body to deliver oxygen and nutrients to tissues and organs while removing waste and toxins for excretion. However, when an injury occurs, continued blood flow could result in excessive blood loss, leading to death. To prevent this, a blood clot forms to plug the cut and stop the bleeding. A blood clot is a mass of various blood cells bound together by platelets and fibrin. However, blood clots can also form within the circulatory system if blood coagulates into a mass. Such clots can reduce or stop blood flow to parts of the body, posing a serious health threat. This can lead to problems like the rupture of blood vessels, embolism, heart attack, stroke, or even death. In this video, we explore the foods and some major causes that can cause blood clots. Foods and major causes that cause blood clots. Major causes that cause blood clots. Obesity. Over the past 40 years, the number of people who are obese has more than tripled. Today, nearly 1/3 of the world's population is either overweight or obese. This condition comes with high and dangerous health risks. Obesity can lead to blood clots and diabetes. The extra fat around the arteries puts pressure on the veins, restricting blood flow and significantly increasing the risk of blood clots. Being overweight is also linked to a sedentary lifestyle, which is another risk factor. Obesity often leads to diabetes, further increasing the risk of blood clots. To lower your risk of obesity and blood clots, practice a healthy lifestyle by staying active and eating nutritious meals. Prolonged sitting for long periods without moving poses a risk similar to surgery or injury. According to the experts, the longer you sit, the higher your chances of developing a blood clot. This risk is even higher for people with a history of deep vein thrombosis, DVT, diabetes, or inherited blood clot disorders. When traveling long distances by air, road, or water, take breaks every 2 or 3 hours to walk around. Other activities to keep your legs active include stretching and flexing your ankles with your legs spread out. These movements help increase blood flow and reduce the risk of blood clots. For people with DVT, doctors may recommend anticoagulants and compression stockings. Smoking poses many health risks due to its harmful effects on the body. It can also cause blood clots by damaging the lining of blood vessels. Studies have shown that smokers are more likely to develop blood clots than non-smokers. The risk is even higher for smokers with other risk factors, such as inherited blood clot conditions or using oral contraceptives. However, smoking is one of the most preventable risk factors. If you want to quit smoking, there are many resources available, including smoking cessation programs. Varicose veins, often called spider veins because they look like spider webs, are a common cause of blood clots. These veins are close to the skin's surface and occur when blood doesn't flow properly from the legs to the heart. Instead, some blood flows backward due to faulty valves, increasing the risk of blood clots. This condition is usually painful and can be prevented by avoiding long periods of inactivity. If you work in an office, try to move around or exercise your legs throughout the day. Abnormal heart rhythm. Atrial fibrillation is a condition where the heart beats irregularly, which can lead to serious health problems. Many people with this condition don't realize how dangerous it can be. Irregular heartbeats can cause blood to stagnate, leading to clots. These clots can travel to the brain and cause a stroke. Treatment options for irregular heartbeat include surgery and pacemakers. Surgery or injury surgery can cause blood clots for 2 main reasons. First, when foreign objects are introduced into the body, blood tends to thicken and form clots. Second, surgeries often take hours, during which the body is inactive and blood flow is reduced. After surgery, patients usually have long periods of rest, increasing the risk of blood clots. To reduce this risk, post-surgical patients should try to move around regularly. Pregnancy can increase the risk of blood clots due to hormonal and physical changes in the body. As the body gains weight, it puts pressure on the pelvis and legs, which can compress blood vessels and raise the risk of clots. Hormonal changes, like higher estrogen levels, also contribute to this risk. Postpartum, the risk of blood clots decreases significantly after about 7 to 12 weeks. To lower your risk during pregnancy, stay hydrated and keep active. Older age. As people age, the risk of developing blood clots increases, especially for those over 50. Although the exact reasons are not fully understood, older adults are more likely to have conditions like deep vein thrombosis, DVT, or cancer, which are risk factors for blood clots. Older people may also face other health issues like diabetes and high blood pressure that can affect blood circulation. Cancer and its treatments can raise the risk of blood clots. Cancer patients, particularly during chemotherapy or prolonged bed rest, often experience long periods of inactivity, which increases the risk of clot formation. Chemotherapy can also contribute to this risk by affecting the blood's ability to clot. While you can't change these risk factors, monitoring for signs of blood clots and seeking medical help promptly is crucial. Oral contraceptives can increase the risk of blood clots by affecting hormone levels, particularly estrogen. This risk is higher for smokers and those with a family history of blood clotting disorders. Newer contraceptives, like the mini pill, contain progestin, which has a lower risk of causing blood clots. If you're using oral contraceptives, quitting smoking can help reduce your risk of clots. Foods that cause blood clots. 1. Red meat. Red meat is rich in saturated fats and cholesterol, which can elevate levels of LDL, bad cholesterol in the blood. This contributes to the formation of arterial plaques, which can lead to narrowing of the arteries and increase the risk of blood clots. Chronic inflammation associated with high intake of red meat also plays a role in clot formation. 2. Processed meat. Processed meats contain high amounts of sodium, nitrates, and other preservatives. Sodium can cause high blood pressure, which damages blood vessels and promotes clotting. Nitrates can convert to nitrites in the body, potentially leading to inflammation and endothelial dysfunction, further increasing clot risk. 3. Fried food. Foods that are fried are often cooked in oils high in trans fats and other unhealthy fats. Trans fats are known to increase LDL cholesterol and decrease HDL, good cholesterol. This imbalance promotes arterial inflammation and atherosclerosis, which can lead to blood clots. 4. Sugary foods and beverages. High consumption of sugary foods can lead to weight gain and obesity, which are significant risk factors for blood clots. Excessive sugar intake can also result in high blood sugar levels and insulin resistance, contributing to inflammation and clot formation. Sugary beverages can exacerbate these issues by providing excessive empty calories. 5. High sodium foods. Excessive sodium intake can lead to elevated blood pressure, which stresses and damages blood vessel walls. This damage increases the likelihood of clot formation. Sodium also contributes to fluid retention, which can exacerbate hypertension and contribute to the risk of clots. 6. Foods rich in vitamin K. Vitamin K is essential for the synthesis of clotting factors in the liver. While normal levels are crucial for blood clotting, excessive intake can interfere with blood-thinning medications like warfarin. This can disrupt the balance needed for proper clotting and increase the risk of developing clots. 7. Refined carbohydrates. Refined carbohydrates, such as white bread and pastries, are quickly digested and can cause spikes in blood sugar levels. This can lead to insulin resistance and obesity, both of which are risk factors for blood clotting. Additionally, these foods often contribute to systemic inflammation. 8. Alcohol. While moderate alcohol consumption may have some cardiovascular benefits, excessive drinking can increase the risk of blood clots by causing liver damage. The liver is responsible for producing clotting factors, and damage can impair its function, leading to an imbalance in clotting mechanisms. Alcohol also affects platelet function and can interact with anticoagulant medications. 9. Trans fats. Trans fats are known to increase LDL cholesterol and decrease HDL cholesterol, leading to atherosclerosis and inflammation. This creates an environment conducive to the formation of blood clots by damaging the lining of the blood vessels and promoting clotting. 10. High cholesterol foods. Foods high in cholesterol can contribute to the buildup of plaques in the arteries, leading to atherosclerosis. The accumulation of these plaques can narrow the arteries and make it easier for blood clots to form. High cholesterol levels are linked to increased clotting risk and cardiovascular diseases. Managing your diet and being aware of these factors can help reduce the risk of blood clots and associated health issues. How to prevent blood clots naturally? Preventing blood clots naturally involves a combination of lifestyle and dietary changes aimed at promoting cardiovascular health and improving circulation. Regular physical activity is crucial. Exercise helps improve blood flow and reduce the risk of clot formation by keeping blood moving and preventing stagnation. Maintaining a healthy weight through a balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, supports overall vascular health and reduces inflammation. Staying hydrated is also important, as adequate fluid intake helps maintain blood volume and prevents it from becoming too thick. Limiting the intake of processed foods, high in sodium, trans fats, and added sugars, reduces risk factors such as high blood pressure and cholesterol levels, which can contribute to clot formation. Additionally, incorporating foods with anti-inflammatory properties, such as omega-3 fatty acids found in fatty fish and antioxidants in berries, can help reduce inflammation and support healthy blood flow. Avoiding prolonged periods of inactivity, such as sitting for long hours, and incorporating regular movement throughout the day can further reduce the risk of clots. Thanks for watching. If you found this information helpful, please consider subscribing to our channel and giving us a like. We wish you good health and happiness. Stay active, stay informed, and take care.